From procrastination to biting our fingernails, we all have millions of bad habits that are usually overlooked. But do you know if a few of them consistently go unnoticed, they will certainly cause serious health conditions? Whenever it comes to being healthy, all the organs in our body play an essential role in maintaining optimal health. Our kidneys, as well, are the vital organs that ward off all the toxins from the body and help regulate blood pressure. They help our hormones strengthen our bone health as well. So, what if your regular bad habits disturb the functioning of your kidneys? The healthy balance of hormones and minerals will then be wiped out, causing the accumulation of toxins in your blood, which will in turn lead to bad health. From excess salt intake to holding your pee for too long, in this video we have listed some of the most common bad habits that are negatively affecting your kidney health. Number 1. Eating too much salt. Undoubtedly, because of the presence of essential minerals such as sodium, the consumption of salt is crucial to maintaining the fluid balance and integrity of nerves. But adding too much of it to your diet can cause alarming situations in your body. Kidneys are, by far, the topmost organ to be affected by excess salt intake. This is because eating too much salt results in the accumulation of sodium in the vessels of your kidneys, which, in turn, doesn't let your kidneys filter the extra amounts of fluid from your body. The increased fluid retention results in increased blood pressure in the vessel walls, which provides room for many comorbidities. This is why the American Association of Hearts has recommended limiting the sodium intake to 2,300 milligrams per day, which makes a total of only 1 tablespoon per day. So if you are looking forward to cutting down on your excess sodium intake, you must say a straight no to all processed and frozen food packages because of their high salt percentages. Just make sure to put your fingers on fresh food cooked from scratch. Number 2. Not drinking enough water. Have you ever counted the glasses of water you're having per day? What do you think? Why is it so important to do so? Well, let me break it down for you. As long as you're sipping enough water your body needs to stay hydrated, your kidneys keep playing their role of flushing out the toxins and excess fluid from the body at an optimal pace. That's because water is fuel for the kidneys to help them pull all the toxins and extra fluid down into the bladder in the form of urine. But not drinking enough water can lead to the buildup of waste products, which in turn can result in a condition called prerenal azotemia, an acute kidney disease. Dehydration can increase the progression of chronic kidney diseases as well, so staying hydrated certainly helps you avoid kidney problems to a great extent. But don't you wonder how much water you should drink each day? Well, the amount of water you need varies with your age, weight, and general health conditions. Anyhow, the rule of thumb is to take 1.5 liters to 2 liters per day, or it may be 1/2 of your body weight in ounces every single day. Number 3. Holding your bladder for too long. Whenever you are busy or can't find a bathroom place nearby, ignoring your urination urge is what you frequently prefer. But do you know that holding your pee for too long ultimately puts your kidneys at risk of diverse infections? Here's how. Holding your pee for too long provides room for the bacteria to grow in your urinary bladder, which in turn leads to urinary tract infection or UTI. Urinary tract infections are very painful and, if not treated, put stress on your kidneys and cause serious organ damage. To protect your kidneys from serious complications, you must rush to empty your bladder whenever you feel the urge to urinate. You shouldn't hold your pee for more than 4 hours and make sure to empty your bladder to its fullest every time you pee. So whenever nature calls, you gotta go to flush it out. Before we move further, if you are enjoying this video, make sure to hit the subscribe button along with the bell icon to stay tuned for all the updates. Number 4. Overdosing the painkillers. It's unusually not uncommon for girls to use a large dosage of painkillers over the years because of their severe menstrual cramps. Patients with chronic joint pain or arthritis also consume a large volume of pain-relieving medications. When it comes to kidney failure, painkillers are by far one of the most common culprits that pose a serious risk for long-term kidney damage. Whether it is the over-the-counter dosage or a physician's recommendation, taking too many painkillers in the long run can severely damage your kidneys. This is because the overdosage of nonsteroidal anti-inflammatory drugs or painkillers results in the decreased flow of blood towards the kidneys, which in turn causes scarring and inflammation of the renal tissues. Kidney diseases due to the frequent use of pain-relieving medications such as ibuprofen or Advil is called analgesic neuropathy. The National Kidney Foundation has reported that 1 to 3% of chronic kidney diseases are documented due to the overdosage of pain-relieving medications. Stop your hands from overdosing on painkillers. Your kidneys will then happily serve you. Number 5. Eating lots of proteins. Proteins, for sure, are a good source of nutrition, but as you know, access to everything is bad, and so are the proteins. Adding food high in protein such as meat to your diet is bad for your kidney health, and that's because animal protein present in meat damages your kidneys to the extent that they cause acidosis. Acidosis is a condition in which your kidneys fail to filter the toxins from the body. The excess fluid buildup in the kidneys increases the oxidative stress in blood. The increased acid levels in your body don't let kidneys get rid of the free radicals fast enough. This eventually leads to chronic kidney diseases and decreased bone mineral density because of the hormonal imbalance. So, to cut short on your excessive protein intake, you must go for plant-based sources of protein such as beans or nut seeds. These foods are not only a good source of balanced proteins, but are high in fiber as well. They will certainly lower the levels of acids in your body and will reduce oxidative stress as well. The dietary reference for protein intake has recommended to take 0.8 grams per kilogram of body weight per day. Anyhow, this amount may vary depending on the age and activity level of adults. Number 6. Having too little or too much sleep. Do you have a habit of catching up on your work emails while staying up late at night? What if you get to know that staying up too late at night can significantly affect the health of your organs? Kidneys, like all other organs of your body, follow the circadian rhythms of your sleep-wake cycle. This natural sleep-wake cycle regulates the functions of your kidneys in such a way that when you are sleeping, the workload on your kidneys is reduced and they are in a rest mode. On the other hand, when you wake up, kidneys resume their normal function and filter all the toxins from the blood. So when you don't get enough sleep, the circadian rhythm of your body is disturbed, which in turn disrupts the activity of the kidneys. A study published in the American Society Journal of Nephrology has reported that people who sleep less than an average of 6 to 7 hours sleep and have poor sleep quality have a 65% higher risk of developing proteinuria, a condition in which excess protein is present in urine, which is a clear indication of an underlying kidney disease. Similarly, people who sleep more than 9 hours per day were also found to have an increased risk of developing kidney disease, which suggests that having either too little or too many sleep hours does not let your kidneys perform their normal functions of regulating the release of hormones. So, to reduce the oxidative stress from your kidneys, make sure to have average sleep hours and a normal sleep-wake cycle. Number 7. Being addicted to alcohol. Being a worse diuretic, alcohol will increase your urge to urinate more often. Frequent urination ultimately leads to dehydration, which will, in turn, increase the workload on your kidneys. Excessive alcohol intake will make your kidneys work hard to restrain the fluid balance in your body because of the frequent urination. Being addicted to alcohol significantly affects your liver health as well. This is because alcohol increases the release of a substance from your liver known as urea, which is usually filtered by the kidneys. However, drinking too much alcohol results in an uncontrolled release of urea, which makes it hard for the kidneys to filter it. This increases oxidative damage to your kidneys and results in chronic kidney diseases as well. So, to avoid kidney problems, make sure to limit your alcohol intake. 1 drink of alcohol per day is usually recommended for women, and 2 are for men. Try to avoid it on an empty stomach. Your kidneys are vital organs and need attention to perform their regular activities. The prevention guidelines mentioned in this video will certainly help you avoid kidney diseases and will slow down the progression of chronic kidney diseases as well. Before you leave, make sure to give this video a thumbs up.